Start protecting your arteries now. Hello, Happy New Year, and welcome to another edition, the first edition of NextGen MD for 2026. We've got Dr. Lily Johnston here, incredible vascular surgeon from Southern California, and we are going to be talking about New Year's resolutions. But do us a favor, make a New Year's resolution right now. Get it over with. Like this video, subscribe to our channels, Lily Johnston MD on YouTube, and also The Way to My Heart. It helps get our message out. It helps save life and limb because when you like our videos, you subscribe to our channel, YouTube says, aha, there's some good information here that people like and want to continue to follow. So we're going to show it to more people, which really helps us on our mission to save life and limb. But welcome, Dr. Lily Johnston. Thank you so much for being here. What is your number one New Year's resolution?
Well, hi, Happy New Year. How are you?
Good. I'm already making my commitments. I'm actually honoring, I already walked 80 minutes on the treadmill today, and I took my glass. I do a shot glass of chia seeds soaked in water overnight. So those are two of my resolutions, and already continuing to follow them.
That's amazing. That's amazing. Great job. So mine, I don't really make New Year's resolutions, but my two best friends and I have a pact every year that we will take care of ourselves. And so we all talk to each other and promise what we're going to do. Last year, it was like to make sure I got to the dentist and got my teeth taken care of. Maybe that was 2 years ago. I can't remember. In any case, this year I am due for a mammogram, so that has to get done. And I am also due for some repeat lab tests. So I think it's time for that.
Here in Marin County, we just had an article that came out, and it was an op-ed, and it was a gynecologist who came out and said she really wishes that instead of mammograms, that people would instead choose to get ultrasounds. She said they're more effective and they're less risky, less radiation, whatever it might be. So something to consider.
I have not seen data for that, but I think any imaging is better than no imaging.
That's true.
Maybe.
I just had my
Actually, I'm not
mammogram,
sure about
so
that, but maybe.
it's just a matter of making that New Year's commitment. What are the tests that you need? What are the appointments you need? You always need to make sure that you have an appointment with annual appointment with your PCP, getting that regular basic blood work at the very least, making sure for women seeing the gynecologist, making sure everyone, especially if you have diabetes, right, to see the podiatrist, making sure you have your annual appointment with your vascular surgeon, if you have P.A.D.
Absolutely.
So if someone is making a New Year's commitment to protect their artery health in particular, what are the specific tests that they should resolve to ask for, so that they actually know what's going on inside their arteries, whether it's their legs or their heart?
It really depends where you're starting, Kim, but I would say at a bare minimum, you should know kind of the basic lab values. So I want you to have your complete blood count, your metabolic panel, your lipid panel. Additionally, we're going to need a high sensitivity C-reactive protein as a marker for severe inflammation in the body, and an Lp(a). If you've never had that done in your life, you need that done this year. That's a really good start. If you already know that you have P.A.D. or coronary vascular disease, make sure that you get your follow-up imaging test that's been recommended. And if you don't know, this would be a great year to get one of the screening tests that we've talked about before, whether that is a coronary calcium score, a carotid intima media thickness test, a CIMT, or a CCTA, a CT angiogram of your coronary arteries to see whether there is any plaque there that needs more aggressive intervention.
It's interesting. I was just reading a study, and I wish I would have pulled it up. I should have pulled it up before today and brought it to your attention. But I can tell you in general that this study was showing that new evidence that possibly CRP is a greater indicator of risk for heart attack, stroke, and amputation than even the basic lipid panel. What are your thoughts on that?
I think they are all important, and we just don't know in which patient which thing is more important. So it is all, plaque is the end result of all of these things. And for some people, the inflammation is really what's driving things. For other people, it is a lifetime of exposure to, these pro-atherogenic or pro-plaque forming oxidized lipids. For other people, it's the insulin resistance. I didn't mention fasting insulin. If you haven't had that checked, that's another good thing to add to your list for this year. So it just depends on, which of the phenotypes or which of the kind of characters that end up with plaque you might be, and which pathway is more important. There are plenty of people who have plaque who have a normal CRP, but there are lots of people who have a normal lipid panel too. And again, each individual, we're going to have to do a little investigation and a deep dive to understand what drove it for them specifically. But if you're unsure and just trying to go for that shotgun approach, then understanding all of the above is important.
Yeah, what is that one? I mean, you've named a whole bunch, but sometimes people end up where they get overwhelmed. So, one vascular or cardiac test you wish more patients would make a non negotiable to request annually rather than waiting until symptoms arise or symptoms just persist.
Probably a fasting insulin level and along with a fasting glucose level. So you could calculate a HOMA IR if that's important. But even just a regular fasting insulin level will allow us to potentially detect insulin resistance long before it turns into prediabetes or even type 2 diabetes. And that is what I see get out of control more often than anything else.
Yeah, there are so many primary care doctors that they'll test a patient and they'll say you have pre-diabetes and say, oh, don't worry about it, it'll be fine. Pre-diabetes is something, right? If you have pre-diabetes, you need to do something. You need to make that New Year's resolution to take care of that today and start today to bring that A1C down.
Yeah, the damage related to elevated blood sugar starts even before that 5.7 hemoglobin A1C value, which is the cutoff for prediabetes. It starts closer to 5.5. We start seeing as average blood sugar increases, we start seeing more and more risk for all of the things, trouble with vision, trouble with kidneys, trouble with blood vessels. And that is almost a linear relationship as average blood sugar increases above a strictly normal level. So by the time you're pre-diabetes, you are already sustaining damage to organ systems, and that's a fire in my book.
For people who have diabetes, for people who have chronic kidney disease, for people with heart disease, they notice that they're slowing down, they're getting leg fatigue, they're feeling dismissed, that that cramping in their legs is just aging. What would you want their New Year's resolution to be when it comes to advocating for a vascular evaluation?
If you're worried about the legs specifically, please go get an ABI or an ankle brachial index. And better yet, maybe one with exercise, especially if those symptoms are mild or they only bother you when you exercise. And go get checked out for that. The test is not perfect. I have definitely seen patients who have disease and a normal exercise ankle brachial index, but at least open the door, start the conversation. And if you're still worried and you feel like the test may not have captured you, ask for a referral to talk to a vascular specialist.
What about when it comes to diet? If patients had to commit to just a few tangible changes this year, which ones consistently make the biggest difference in artery health and disease progression when it comes to peripheral artery disease, which you were talking about a moment ago, or heart disease?
It's a loaded question. I think the thing
No.
that probably would move the needle the most for people that is very tangible, right? Very constrained would be like stop drinking sugar calories, right? Don't drink regular soda. Don't drink juice. Don't drink really sweet coffee beverages. If you can lean into the non-nutritive sweeteners, those are things like monk fruit, allulose, stevia. Great. It's better than nothing. But, in terms of helping manage insulin resistance and diabetes, helping manage things like fatty liver disease from the fructose, the high fructose corn syrup that sweetens a lot of the sweetened beverages. I think that is like a pretty straightforward commitment. It's not easy, but at least it's simple, and it can be a nice sort of rule of thumb. And I think we can all agree, no matter which dietary camp you come from, that we should not be drinking calories by and large.
It's interesting that you say that because Dr. Sanjay Gupta from CNN, he does radio spots for Better Health. And his today was all about the diet soft drinks that have the artificial sweeteners. People think that they're healthier because they don't have regular sugar. And there was a study that came out of Europe just recently that showed that these diet drinks can literally lead to fatty liver disease just the same as alcohol. And I thought that was really interesting.
Fascinating. I have not seen that paper, but I'm curious to know what it says. That's great.
I will see if I can find it. I haven't looked at it. I just heard it on the radio today when he was talking about it. And he's a fairly credible source, as I believe a cardiologist, I think by trade. But I listen to a lot of his tips, which are pretty good and tangible. And he said, make sure to drink water, 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 and more water. That's a great New Year's resolution.
Yeah, I mean, that's absolutely the best choice. I leaned pretty hard into sparkling water myself, but I was a big Diet Coke person for a long time. And if the choice is between regular Coke and Diet Coke or Coke Zero, I think Coke Zero is a better choice. Is it the perfect choice? No, but done is better than perfect. So I would love for people to start working on that. And if you can get off all of the diet sodas too and the artificially sweetened things, great. And nevertheless, I still think it's better than regular soda.
So, what is another realistic resolution that you think that most people could keep all year long? Realistic, that they could keep all year long that would meaningfully actually reduce inflammation and support better circulation in particular?
If we're talking about all things, I would say, increase your activity level, right? Exercise more, and whether that is walking or resistance training, even yoga, Pilates, dancing, whatever. A good program would include all of those things, but whatever you're doing, can you add one more day a week? Can you add 10 more minutes a week? What else can you do to whatever you're doing now is awesome. Many people are already very active, but the older we get, the more muscle we begin to lose. We actually have to increase the amount that we're walking and that we're working to just maintain our level of fitness and muscle mass. So what can you add this year that would be reasonable? And if it's 10 minutes a week, great. That is something. And just stick to that. Make it an achievable goal. I think where people really go wrong with New Year's resolutions as they try to sort of eat the whole elephant all in one bite, and it's very overwhelming, and they get really excited about it for a few weeks, but you can't do that indefinitely. And I would much rather people had a small, modest, easily achievable goal that didn't feel like a huge big win, but over time those small efforts that are done consistently will compound and make such a big difference for people.
Even if it's just you want to work on your walking to improve claudication, a lot of, you're supposed to do 30 minutes a day, right? One full session, at least 30 minutes. But if you're going to start somewhere, what do you think about just saying, okay, I'm going to commit to 30 minutes a day, but it's going to be in 10-minute increments? Because for so many people that have claudication that comes along with peripheral artery disease, that poor circulation in the legs, they have a fear of pain. They have a fear of claudication. They have a fear of taking the next step.
Yeah.
What do you think?
However you can get it done is great. If you are already walking some, that's wonderful. I don't tell people to go to 30 minutes. I tell people whatever you're doing now, do that for a week and then go up by 10% next week. So whether that's up to 30 minutes or whether that's up to 3 minutes, a little more every week, an incremental change and improvement. And if you are not walking at all, what I want is for you to put on your shoes and open the door or get into the room with your treadmill. You don't have to walk.
At least
You
get in
literally
the
don't
room.
even have to step off of the patio. I want you this week to put on your shoes and either step into the room with the treadmill or just step onto the threshold of your door and
Love
just
you.
do that. That is your goal this week. By next week, you can go to the mailbox and back, or you can turn on the treadmill and off, right? I want it to be stupid easy for you to win and get it done and check the box so that next week you feel excited because you already succeeded.
That's true. I mean, one of the biggest issues I think people have in terms of consistency and meeting their goals is that one day, that one setback, and they kick themselves. I didn't do it today. Like with ours, we have our smoking cessation group on Monday nights, and the most consistent thing I hear over and over and over again is, "Oh my gosh, I'm so mad at myself because I lit up a cigarette or I had two instead of one today." And they kick themselves. Well, what happens when you kick yourself? You're causing more stress. Well, stress is what triggers having another cigarette. So instead of having one or two, now you're going for three, now you're going for four, and you're kicking yourself and it's leading to more cigarettes. It backfires on you. You can't kick yourself. I love the way you frame it, that you have to focus on the little things and celebrate the little wins, no matter how small.
Yeah, I mean, it's why people in recovery get coins for the days that they are abstinent. And it's an acknowledgement that you will fail. You absolutely will fail. All recovery programs that I am aware of, I've not participated, but I've had friends and family in them. It is assumed that you will go back to your addiction more than once, more than twice. It is part of the process. Every time that happens, you learn a new lesson about a trigger, about an environment, about something, and you start over. And it's just part of the expectation. This is how this works. And exercise is the same way. Our nutrition is the same way. We all slip. It's okay. It's part of the deal. Perfection is not the expectation. Doing better today than yesterday, 1% better. That's it. That's the expectation.
So it sounds like what you're saying is consistency is a lot more effective for most people than intensity, no
Yep.
matter what the habit. It's just a matter of consistently doing something versus
Yeah.
nothing.
And continuing to challenge yourself, never getting complacent. Even those people who are already fit, who are already, eating well, like what else can you do for your health? And maybe the answer is you should do less, you should sleep more, you should rest more and get better recovery. I don't know what the answer is for any given person. I know that all of us have room to continue to improve and grow.
So, what is that one habit that you wish people would resolve to just stop doing this year because it quietly undermines artery health? Even if everything looks good, it sounds like kicking yourself is probably something they should stop doing, is one New Year's resolution.
Uh, I would say if you can quit eating when dinner is over, that would be great. That will help with your insulin sensitivity. It helps with the emotional eating and snacking. It's a personal thing for me to focus on too, because I am pretty bad about this. And I get a lot of people who, have a tendency to just nosh or have a little sweet treat before bed. And it totally resets your insulin. You have to start all over in terms of, fasting clocks and all of this. And eating earlier is great. It's impractical for a lot of us. But I think if you could just settle on like when dinner is over, and if I have some fruit at the end of dinner or my treat, fine. But when dinner's over, cabinets closed, kitchen's closed, lights are off, and we're done eating for the night, that would be a great thing. It'll help you sleep better. And if you can also abstain from your device for about half an hour before bedtime, so blue screens, TVs, whatever, that will also improve sleep. And that's kind of a twofer. You asked for one thing, and that's really two. But I hope that either one is an option for people who are looking to improve their health, especially their sleep and their nutrition.
Oh, it's so important. And I love that you focus on sleep because there have been numerous studies that have been done that show that sleep can increase your risk of a heart attack, and it increases the inflammation in your body having lack of sleep. It does. If you're not sleeping, you're not allowing your body the time to renew. And there's a company out there that's brand new that I think you would appreciate. It's a company called Ella Mind. The CEO, Meredith Perry, if you watch her on LinkedIn, everyone should follow her on LinkedIn. She is hilarious. She has her marketing campaign, Sleeping with the CEO, and she goes out on the streets of New York and on trains and things like that, and she puts this device on people's heads, and within 15 minutes these people are out. It's
Wow.
amazing. So she's going to be on our show on January 31st, and
That's
we're going to talk
exciting.
to her more about that. She's just a wonderful human on this planet, good person, and I love to see what she's doing here with this particular device. I know that there are some large research organizations, universities that are in Europe that have contracted with them because they love the device and they want to do some sleep studies with it. So we're going to see more and more probably with Ella Mind. I don't know if it's a product that people can buy yet. Probably have to go look. I haven't looked yet, but it's something that people can learn more about, on our channel on YouTube. On January 31st.
Well, I'll be
But
watching. That sounds great.
yeah, we might even have to include you. We might have to see if we can get you a device to try.
Oh,
And we'll
that's
put both
exciting.
you and Dr. John Phillips to sleep at once, which would be amazing during a live show. See if it
Great.
really
Let's do it.
works. So, as you think about one final question here, as you think about the year ahead, what are your personal non-negotiables for artery health that you encourage your patients to adopt as their own? Just summarize so much we've talked about over the last half hour. And I think a great laundry list right here and now would be a fantastic way to end.
What I want to leave people with is this idea that no matter how busy your life is, there are people who love you and care about you and that you care for. You have to put your own oxygen mask on before you can put anybody else's on. So if you are a caregiver of a spouse, of a parent, of a child, and you are too busy for your own health, that actually hurts the people you're caring for. You cannot be too busy for this. You will fail or stumble in your efforts to do all these wonderful things for everybody else in your life that you're doing. And especially for my women friends and patients, this is particularly poignant. They're just so busy helping manage everything else in everyone else's life. They're like, I don't have time for me. I'm okay. It's going to run you down. And what I want is for you to recognize that your own health is intrinsically valuable because you as a human are intrinsically valuable, but also, if your why is to be there for your kids or to be there for your partner or for your pets, for whomever, you have to be well to be able to show up for the other people in your life that you're caring for. And that means that you have to take the afternoon to go get your labs done and go get tested for sleep apnea and go get your colonoscopy and go get your screening tests, whatever they may be, and go get that nagging symptom that's been bugging you for 6 months. Like, go get it checked out. Please go get it checked out. There are people who love you in this world who are counting on you, and it is worth the time it takes to pay attention to your own health. And that means your nutrition and your exercise too. Like, all of those things become non-negotiable when you realize that you cannot show up for the world until you are whole.
That's fantastic. I love that. The American Heart Association came out with, I saw one of their social media posts today saying it's so disappointing to see that more people go to the dentist and not the general practitioner
Mm.
each year. Seems opposite of what you're doing, but you're going to the dentist this year.
Yep, I've
But
been to the dentist. I'm good. I'm good
70%
there.
Americans are not going to see a doctor on a regular basis for their primary care, and yet they're still consistent. They're going to the dentist twice a year. So take care of yourself. It's really important. Make that your New Year's resolution, whatever it means to you to take better care of yourself. You can't give 100% of yourself until you're 100% whole yourself. And so make sure, take care, take care, take care. Happy New Year, everyone. Make sure, again, New Year's resolution, like this video, subscribe to both of our channels, youtube.com/the @ sign Lily Johnston MD, and also youtube.com/the @ the way to my heart. Have a great week, everyone. Next week, we are going to be focusing on a brand new study that came out that's talking about a disease that is not getting diagnosed soon enough, yet it impacts 1 in 5 over the age of 60. So you don't want to miss that. That's next week on NextGen MD. Subscribe to our channels to get notified to join us for that one as well. Have a great week, everyone.
Happy New Year. Thanks, Kim.